Good evening and welcome to Cambridge Forum, discussing the Alzheimer's Prevention Program with Dr. Gary Small. I'm Margaret O'Connor, a neuropsychologist at Boston's Beth Israel Hospital and an associate professor of neurology at Harvard Medical School, and I will be your moderator for this forum. Alzheimer's disease currently afflicts 5 million Americans. One American is diagnosed with Alzheimer's every 70 seconds, and right now, the only cure is prevention. Can Alzheimer's disease really be cured? What are the latest research findings useful in the diagnosis and treatment of Alzheimer's? Are there new techniques which can help prevent or at least delay the degenerative effects of Alzheimer's? In his new book, The Alzheimer's Prevention Program, Dr. Gary Small challenges the widely held notion that Alzheimer's is not preventable, and he discusses a variety of ways to keep the brain healthy. Dr. Gary Small is director of the UCLA Longevity Center at the Semel Institute for Neuroscience and Human Behavior, and he is professor of psychiatry at the university's David Geffen School of Medicine. Dr. Small's research, supported by the National Institute of Health, has made headlines in the Wall Street Journal, the New York Times, and USA Today. Scientific American magazine named Dr. Small one of the world's leading innovators in science and technology. Dr. Small lectures throughout the world and frequently appears on the Today Show, Good Morning America, PBS, and CNN. He has written 6 books, including the New York Times bestseller, The Memory Bible. Welcome to Cambridge Forum, Dr. Small.
Thank you, Margaret. Thank you, Patricia. And thank you to everyone who came out to hear what we have to say tonight. It's really a treat for me to visit this part of the country. I lived here for 3 years. I trained in psychiatry just across the river at Mass General Hospital and lived, I guess, a 10-minute walk from here. And it's interesting because as I see one neighborhood, then I start remembering something about another neighborhood. And it reminds me of how our brains work, that our memories kind of live in neighborhoods. And you can remember one thing, and it'll trigger another memory. So we'll talk a bit about that today. But what I want to focus on is the topic of Alzheimer's prevention, as we just heard. And I'm passionate about this topic. I spent 30 years, my entire career, trying to understand Alzheimer's disease, developing technologies to diagnose it earlier before we can see obvious symptoms. I've taken care of families, probably thousands of patients over the years. I've observed the challenges they've faced. I've even experienced it in my own family life, where we've had close relatives who've developed the disease. So I know about the emotional challenges of the illness. And it's one that's touched so many of us. In fact, just a show of hands, how many of us here tonight have a close relative or know someone close to them who has Alzheimer's dementia? Boy, that's probably 95%. The other 5% have tennis elbow and they can't lift their arm. So it's clearly something that affects us all, and we want to try to understand it. But I'm going to have a very positive message tonight. I'm going to tell you that there are things that we can do to protect our brains. Sure, I can't guarantee that you're not going to get Alzheimer's disease in your lifetime. In fact, there's some debate that if we all live long enough, we might all get Alzheimer's disease. Now, there's not enough people who have lived that long to be able to resolve this debate, but there are some who have lived quite long and never gotten it. Probably the most famous one is Madame Jeanne Calment from the south of France, who lived to 122. And they did a brain autopsy and it was the brain of a healthy 80-year-old, and she did not have dementia. She lived the brain-healthy lifestyle. She was physically active, mentally active. The south of France, of course, ate the Mediterranean diet, which we know is good for the heart. It's also good for the brain. In fact, Madame Calment was an astute businesswoman. At the age of 94, she sold her apartment to a French businessman who agreed to pay her rent for the rest of her life. And he died 10 years later. I'm not sure if that's a scheme of some sort, but she did very well. Now, unfortunately, we don't all do that well. And in fact, age is the greatest risk factor for developing Alzheimer's dementia. We already heard about some of the statistics. We know that by age 65 or older, our risk is about 5 or 10%. By age 85 or older, it's 40 or 50%. We have now 80 million baby boomers in this country who this past year began to turn age 65 when they're starting to be concerned about their middle age pauses and their senior moments, and they want to know what to do about it. So it's a big issue for many of us. First of all, what is Alzheimer's disease? The first case was presented in 1906 when Professor Alois Alzheimer described a 51-year-old woman who had confusion, memory loss. She was psychotic, out of touch with reality, and she had a very aggressive illness that killed her within 4 years. He did a brain autopsy, and he stained the brain tissue, and under the microscope, he saw these tiny little protein deposits, amyloid plaques and tau tangles, and they collected in the memory centers of the brain. So this was thought to be a rare presenile dementia, and doctors didn't pay much attention to it until the late 1960s when pathologists started doing autopsy studies of people with senility, what we thought was a normal part of aging. We used to think that as we got older, we just got confused. When they looked at those brains of those senile individuals, they saw the same plaques and tangles. So all of a sudden, we had an epidemic of Alzheimer's disease. In a way, that was good because scientists finally started looking at it as if it was a problem, and they started developing new ways of detecting it and new treatments. When I started out in this field, we had no treatments for Alzheimer's disease. We still don't have a cure, but we do have some symptomatic treatments that help, at least temporarily. When we study the brain and we look at people, say in their 30s or 40s or 50s, we find that there's an occasional plaque and tangle in the brain when we're young. And in fact, these abnormal deposits seem to build up in a very characteristic fashion. With the brain scans, the PET scans that we've developed at UCLA and others have developed, we can see these tiny deposits in people decades before they have obvious symptoms. That often freaks people out. They think, my God, I've got Alzheimer's building up in my brain. I see the positive side of that we can detect candidates for treatment years before there's extensive brain damage, because I'm convinced that it will be easier to protect a healthy brain rather than try to repair a brain once damage is extensive. So with Alzheimer's disease, there are these tiny little deposits that build up, and people often ask about other terms that we use in this field. So just let me throw out a couple of definitions, some basic ones. For example, memory can be understood as learning and recall, two basic components, trying to get information into your brain and trying to pull it out when you want to. Cognition is a term often used in this area, and it includes memory and other mental abilities like reasoning, visual spatial abilities. So it's not just memory, but attention and these other mental tasks. Dementia is the term we often use today to describe what we used to describe as senility, and it's basically a cognitive impairment that requires someone to be dependent on others. But there's a lot of things that can cause dementia. You can get demented from small strokes in your brain, or from a thyroid imbalance, or from a toxicity from a medication. So when people do have cognitive impairment that's affecting their life or they're concerned about, it's important to see a doctor. Not only to rule out these other problems, but also to diagnose Alzheimer's as early as possible. Because Alzheimer's disease is the most common cause of dementia. It has a gradual onset and progression. And when people get started on the medicines that help with the symptoms, when they get started on those medicines earlier, they seem to have a better outcome. We're doing a lot of research to find more effective medicines, to find what we call disease-modifying treatments that may actually change the course of the disease. And if we stop the medicine, it would have a sustained effect. And you've probably read about a lot of these in the news. Drugs to fight the amyloid plaques in the brain. And unfortunately, we don't yet have a breakthrough drug at this point. There's been a lot of investment in it. I think we need to diversify our research portfolio and not just look at amyloid, but also look at tau, another one of the proteins, tau tangles. And that's been in the news lately as well. We're quite interested in it at UCLA because the PET scan we developed is the only one that can measure both the amyloid plaques and the tau tangles. And we've been studying people who have pure tauopathies, or now we're studying football players who seem to get dementia and a lot of tau deposited in their brain. And there was a recent study actually right across the street from Harvard and Columbia that found that the tau abnormalities seem to spread from cell to cell in the brain, almost like an infectious disorder, which is a clue to help us find better medications. And I think pairing this pursuit of looking for new medicines, vaccines, or drugs, along with the detection devices, is really going to be the answer. Because eventually, I think we can come up with sort of a cholesterol test for the brain. You know, if you're over 40 or 50, you go to the doctor will test your cholesterol level, and if it's high, the doctor will give you a statin drug to lower the cholesterol and lower your future risk of a heart attack or stroke. And in the same way, I think eventually we'll have a brain check. It could be a scan, it could be a blood test, and if you have high levels, you'll get a vaccine or a drug to protect your brain and delay your future risk for Alzheimer's disease. But we're not there yet. But prevention strategies is a way to buy time while science is trying to catch up. Now, why do I think that? I think that for a number of reasons. First, there was a big study called the MacArthur Study of Successful Aging. And basically, they defined successful aging as cognitive and physical success. And the take-home lesson from that study is that there's a formula that determines successful aging. 1/3 is genetics and 2/3 is non-genetic. So if that's the case, that means that a big portion of what determines our brain health as we age is not due to what we inherit and not due to our genetics. And there's a large number of new findings that are compelling and telling us that there are lifestyle choices we make every day that have an impact on how our brains age. And the Alzheimer's prevention program teaches us about those lifestyle strategies, makes them understandable, that connection between behavior and brain health, which is critically important. When we understand that connection, we're much more likely to change our behavior, and takes it a step further that I'm very proud of, that we've created a strategy that's very practical where people can get started. Because I can tell you about how important it is to exercise and eat right to protect your brain. And you may start changing things tomorrow or the next day, but chances are it won't stick. And the question is, how do you translate those healthy behaviors into habits? To do that, we created a 7-day jumpstart program where we make it easy for people. We give them options of what to eat for their meals during that week. We give them exercises that build up over the course of the week, and we provide tools in the book that allow people to assess their baseline and their follow-up after a week so you can see your progress, which motivates people to change. It's not unlike going on a diet and stepping on the scale after a week and you see you've lost a few pounds where you're much more motivated to stick with it. So what are those strategies? There's basically 4 areas of our lives where we need to change. Physical exercise, mental exercise, stress management. I know no one here is under any stress, so maybe we can skip over that. Yeah? And then finally, diet. And I'm just going to touch upon each of those areas and tease you with maybe a memory technique to show you how easy it is before we open it up for questions. So let me start with physical exercise because we probably have the most compelling science in that area. And you don't have to become a triathlete to protect your brain from Alzheimer's. In fact, studies find that just walking briskly 20, 30 minutes a day will lower your future risk. There have been some controlled studies, particularly done at University of Illinois, where they'll put older people on a walking program and compare them to stretchers, and the walkers have better attention, have better frontal lobe function, so complex reasoning improves. Their brain function is more efficient, and their brains even get bigger, and a bigger brain is a better brain. So if somebody calls you a fathead, it's a compliment. So physical exercise is important. It gets our heart pumping nutrients and oxygen to our brain cells. We secrete something called BDNF, or brain-derived neurotrophic factor, which gets those brain cells to sprout branches and communicate better and more efficiently. If you can't walk, do anything to get your heart pumping. Swim, move your arms about. Any kind of cardiovascular conditioning is good for your brain. And even strength training. Some newer studies tell us that there might be some additional cognitive benefit, and it might have to do with concentrating on form that provides a mental exercise. And we can get mental exercise a number of different ways. We can cross-train our brain. We have a whole chapter on mental stimulation and how you can train and not strain your brain. You find that sweet spot where the exercise is fun and engaging, but not too difficult. Anybody here do crossword puzzles? Okay, you know that the editors make the puzzles more difficult as the week goes on. I'm kind of a Tuesday through Thursday puzzler. That's where it's fun for me, and everybody has to find where they enjoy that kind of puzzle. Now, you may do those puzzles, and there's not absolute evidence that's going to protect your brain from Alzheimer's. I mean, we've studied what the brain does when it searches online, for example, and we see there's tremendous increase in neural activity. But it may not protect brain health. However, we do know that learning memory techniques does improve memory performance, and you can see the improvement relatively quickly, and the benefits can be sustained for many years. That's as long as they've studied it at this point is about 5 years, and they showed sustained benefits. In the Alzheimer's prevention program, what we've done is we've taken these exercises and made them very practical and targeted the most common memory complaints people have. So does anybody can just shout, what's the most common memory complaint that people have? If you can remember it. What is it? Where you park your car? But I think that's probably happened to everybody. If you do it a lot, that's really concerning, yeah. Names and faces, yeah. 85% of older people complain about that. You see, and in fact, somebody just came up to me, was my neighbor from 30 years ago, and I kind of recognized his face, and then he told me who he was, and then it all came back to me very quickly. So you recognize the face, but you don't remember the name right away. What else is another common? A car, so memory places is another one. I didn't hear that one. Well, the other ones that are quite important are, one is remembering to remember. So you get out of the house and you've left your cell phone at home. Or the other one that's very annoying, the tip of the tongue experience, where you know you should know it, but it doesn't come to you right away. And probably for the first time, we now have exercises that help us with tip of the tongue and remembering to remember, kind of teaching people memory habits. And the techniques build on our basic technique, look, snap, connect. Look is a reminder to focus attention. The biggest reason we don't remember is we're simply distracted. Snap is a reminder to create a mental snapshot of information we want to recall. Our brains are hardwired to remember visually. And finally, connect is a way of linking up those mental snapshots so they have meaning. If something is meaningful, it's much more memorable. So you can apply this technique for a practical challenge like errands. If you're running out of the house and you can't write down a list of things to do, you can, let's say I'm running out and I need to get eggs, I've got to get stamps. So I visualize a big egg in my hand, it's got a stamp on it, and then it slips out of my hand and crashes on my shoe, and then I remember, oh yes, I've got to go to the shoe store. And you notice that memory tool has a lot of action, imagery, and is even emotional to me because I just got this new pair of shoes and I don't like to see the egg on it. So to show you how simple it is to learn these techniques, I'm going to read to you a list of unrelated words. And I want you to imagine in your mind's eye each of those words and then link them together through a story. And perhaps we'll see if somebody wants to volunteer their story in a moment. And the words can be in any order. So do you understand the task right now? Okay. So this is easy. I wrote down the words so I don't have to think of them. This is good. You have no idea the pressure of being a memory expert. It's tremendous. So I'm using this memory tool right here. It's really helpful. So here are the words: beach, professor, horse, teddy bear, cigar, nun, pasta. Okay? So I'd like to, many of you had your eyes closed. That's very good. It's a way to concentrate and focus attention. I mentioned stress. It's not good for the brain. Scientists have found that laboratory animals under chronic stress actually have smaller hippocampal memory centers in the brain. They get lost in their mazes. If you inject a human volunteer with the stress hormone cortisol, there's temporary impairment in learning and recall. And chronic stress can lead to depression, which distracts us and it can hurt our memory ability. There are many ways to lower stress. You can take relaxation breaks throughout the day, just simple breathing exercises, yoga, tai chi. And it's important for people to find different ways that work for them and trying to weave these exercises into their days to help minimize stress. The Alzheimer's prevention diet has a number of important components. The first one is weight management, calorie control. Being overweight or obese increases the risk for Alzheimer's disease. That's the bad news. The good news is if you lose weight, it can actually improve your memory ability. It's also important to eat antioxidant fruits and vegetables, which protect our brain cells from the wear and tear of aging and oxidative stress. Omega-3 fats from fish and nuts fight inflammation. And I'm convinced that chronic inflammation is a problem leading to Alzheimer's disease. Many scientists are thinking about this. Inflammation is generally a good thing. It protects our bodies from infection, but low-level chronic inflammation probably wears down our brain cells. You can see elements of inflammation in those amyloid plaques. And we've done some studies with anti-inflammatory drugs showing they improve memory. Now, the problem with anti-inflammatory drugs is they have side effects. So we're looking at other approaches. We're about to study curcumin, which is in turmeric and curry. In India, there's a lower rate of Alzheimer's disease, but more importantly, our scientists have found that curcumin is a potent anti-inflammatory and seems to attack those amyloid plaques. So we just got the FDA approval to test a high-potency form of curcumin to see if it will delay the onset of Alzheimer's disease and prevent the buildup of plaques. Just other good news about diet is that alcohol in moderation is associated with lower risk for Alzheimer's. And people often ask, well, how much How much is a glass of wine? It's probably 1 glass for a woman and 2 for a man, probably because men are larger. But the scientists think maybe it's resveratrol in the wine. And they leave it to them. They've taken the resveratrol out of the wine, they put it into a capsule, but we're not sure it actually penetrates the brain. So if you're taking resveratrol capsules, make sure you wash them down with a nice Bordeaux. Now, can we really prevent Alzheimer's disease? And there's been some pushback on this concept in the last year. There was an NIH consensus conference that concluded we can't. There's not definitive evidence. And I would agree, we don't yet have a 20-year or 10-year Framingham Alzheimer's prevention study. But I don't want to wait 20 years for somebody to tell me I should be doing these things. And there's enough short-term data, epidemiological data, clinical trial data that's compelling, that shows us that we can improve our brain function, improve our memory performance, improve how we feel right away, and there's a good chance that we may not be able to eradicate dementia, but we might be able to stave off the symptoms. And we've calculated this out, and we give examples in the book of how you might have someone with a genetic predisposition to get Alzheimer's dementia by, let's say, age 72. If that person starts walking regularly, that person might not get symptoms till age 74. If you add on a healthy diet, stress management, they could delay the onset of symptoms by 4 years. That could be meaningful. For some people, that might mean never getting symptoms in their lifetime, which is about as close to a cure as we can get to right now. And it's not just the individual, it's society. We've done some estimates of this where we calculated that if everyone in the United States followed just one Alzheimer's prevention strategy, in 5 years, we'd have 1 million fewer cases than anticipated. Scientists at University of California, San Francisco have done similar kinds of models and attribute about 3 million cases in the US to these modifiable risk factors. So it's an individual issue, it's a public health issue. So to summarize, it's not all up to our genetics. There's a lot we can do to keep our brains healthy, to improve our memory performance right away. And in fact, let's just see, is there anybody, before I turn it over to our moderators, anybody in the audience wants to volunteer their story to remember those words? Any brave soul? Yes. Why don't you stand up and I'll come to the mic and read your story. But you can't check your notebook. I want you to look Snap Connect.
Very short. So the professor was riding his horse, smoking a cigar. He was on the beach when he saw this nun carrying a teddy bear and eating pasta.
Very good. Let's give him a big hand. Now you had the professor smoking the cigar. How many of us had the professor smoking the cigar? Okay. How many had the nun smoking the cigar? Now, did any of you go to Catholic school? Okay. So you can see how fun and easy it is to learn these techniques, and they really make a big difference. And when people combine these strategies, there's a synergy. They feel empowered, they start sleeping better, they start losing weight, and they're on the road to a healthy brain for the rest of their life. Thank you very much for your attention. A recent study found that by age 45, we can see these kinds of changes, but people are functioning reasonably well, and there's not a rapid decline. If that normal aging progresses, people reach a stage we call mild cognitive impairment, where there is a greater risk of getting Alzheimer's dementia. About 10% of people with mild cognitive impairment will get Alzheimer's dementia each year. And there, the memory difficulties are more difficult, and people are compensating more. It takes them more time. And then finally, if it progresses, it's dementia. Certainly, if it's dementia and it's interfering with your life, you need to get some help. But probably more in those stages of mild cognitive impairment where people find they're compensating more is a good time to start seeing your doctor, I think, about those kinds of issues.
Welcome to Cambridge Forum as we continue our discussion of the Alzheimer's Prevention Program with Dr. Gary Small, a psychiatrist and memory expert at UCLA's David Geffen School of Medicine. We asked the question, what does the current research have to tell us about ways to prevent the onset of Alzheimer's disease? At this point in the program, we'll take questions from the audience. Please line up at the microphone and ask one question.
I have a question for you. Essentially, I agree with most of the things you've discussed. The only thing I don't agree with you is Alzheimer's can be cured. And the way it's going to be cured now or in the future is going to be through natural medicine. Natural medicine. That's something the FDA doesn't want to hear. But there are a number of different memory medications that are out right now that if people took the time to right away and get those particular pills, you'd be amazed at how quickly their memory would return.
Well, thank you for that opinion. And actually, in the Alzheimer's prevention program, we have an entire section on supplements in some of these natural medicines and some of the scientific evidence for them and against them. One of the challenges that we have with supplements is that to get them approved and marketed, you don't need the same level of scientific testing as you do for a prescribed medication. So generally, to get the FDA to approve or clear a prescribed medicine, you have to test the actual drug against a placebo or inactive pill or sugar pill, and it's double blind. Nobody knows who's getting what because placebo actually works temporarily. In fact, if we all took placebo this morning, we probably all feel a little better today. The trouble is that effect wears off, and so it's getting a little more rigorous. There's more testing of these approaches, and as I mentioned, we're testing curcumin. In the book, I preview some of the work we've done with pomegranates. Pomegranates are very potent antioxidants, and they have polyphenols in them. And we found in a short-term study that it actually improved memory. And so now we're testing it, trying to replicate that in a larger sample. So I think there probably is merit to some natural treatments, but I think we need to learn more about them.
Dr. Small, I actually had the police officer who was patrolling the beach on horseback that was smoking a cigar, but
I thought you were bringing back a memory when I got arrested in Harvard Square 30 years ago. Those emotional memories really stick, don't they?
But what you said about inflammation leads me to a question. You said there were not a lot of studies, but I wonder about a study about use of aspirin, because I heard the other day that aspirin reduces inflammation, may also reduce risk of cancer, and with a long time now people have been using small doses of aspirin. Has there been any correlation with reduced Alzheimer's disease with aspirin use?
In the 1990s, there was a report from the Baltimore longitudinal study that found that people who took not aspirin, but actually other anti-inflammatory drugs, ibuprofen and naproxen, which would be Motrin or Aleve, if they took those drugs for 2 or more years, they had a 60% reduction in their risk for Alzheimer's disease. So this kind of spurred a lot of interest and a lot of studies, and the results have been conflicting. Overall, there hasn't been much signal, as we say, for aspirin. But the other drugs, there has been an off-and-on signal. And as I put together this evidence so far, it seems to me that anti-inflammatory medicine may help in middle age when people don't have a lot of those amyloid plaques in the brain. But if they already have dementia, some studies suggest it even could accelerate cognitive decline. So it's an issue of timing. A lot of these medicines or approaches may work at one stage of brain aging, but not at another stage. So I'm not sure whether aspirin is brain protective. I think some of those other anti-inflammatory drugs may be, but again, I wouldn't recommend that people go out and start popping them without their doctor's supervision. And if you're taking it for aches and pains or arthritis, it may be protecting your brain, but I don't think we're at the stage where we can use it to prophylactically for brain health.
Excuse me. Thank you, Dr. Small. We all know that behavior change is difficult, even if you're highly motivated to make these changes. Do you have any kind of comparative data, or can you talk a little bit about what might make someone more motivated to follow a program such as yours to prevent or delay Alzheimer's versus diabetes or heart disease? Because there's similarities to what you're talking about and what can help in those potential conditions.
So I think that there are a couple things that motivate people, and probably the biggest one is a fear factor. If you have a family member and you've seen it in your life, every little middle-aged pause, you may joke about it, but behind the humor is anxiety. So I think that's one. Secondly is age, because as we get older, we notice these changes in ourselves more, and so we're more inclined to do something about it. And I think the third issue, people are certainly concerned about cancer, they're concerned about diabetes, but there's something about Alzheimer's that really, hits us at the core, because our memory, our cognition, it defines who we are as people, and that's near and dear to us, and we certainly don't want to lose that. So I think those are important factors, and what we've learned on the positive side is that when there is a connection between the behavior and the benefit, people are more inclined to follow the behavior. There's been some studies at UCLA that have found that. So I think the education piece is critically important to motivate people.
Hello, Dr. Small. How are you? I wonder, are there any particular cognitive activities that correlate more to the prevention of Alzheimer's than others that you're aware of?
Were you thinking of any particular one that you're doing?
I'm not sure if it correlates to the prevention of Alzheimer's, though. Sure, I do some mental activities. I'm not sure what research says about that, though.
I think we really haven't pinned it down in detail, but you can, there's so many different activities that seem to be beneficial. There have been some studies showing that dancing is helpful. And you can think, that there's a physical exertion that probably pumps oxygen and nutrients to your brain. And there's the cognitive challenge of learning the steps and following through. Any kind of sport that is competitive, tennis, ping pong, probably benefits the brain. Even juggling improves your brain. You can get a bigger brain from juggling, and it'll be your right brain. In fact, driving a taxi could protect your brain. There was a famous London taxi driver study finding that the size of the right hippocampus correlated with the number of years of taxi driving, and the right side of the brain tends to be visual spatial. So they were building their ability to read maps. So we really haven't pinpointed where we can say that it's better to play ping pong than racquetball. Although I'd expect racquetball would probably be better because you're getting more physical exertion. But I would recommend that people do things that they enjoy that are challenging, because they're more inclined to do it over time. And the studies suggest that if you keep it up regularly, it's going to protect you. Yeah.
Thank you, Dr. Small. A question. Your plan seems very similar to the preventative measures for heart disease. Have there been several studies of comorbidity with Alzheimer's and heart disease, or other similar diseases that could be prevented in a similar way?
Well, there haven't been studies that have focused on that question specifically, but a lot of times you can look at similar data sets and see whether a certain behavior protects a different outcome. And certainly the Mediterranean diet, there have been studies showing it's good to lower the risk for Alzheimer's, and it's good to lower the risk for heart disease. So there's certainly overlap. And in fact, one argument I use to argue that Alzheimer's is preventable is that we know that two of the major Alzheimer prevention strategies, physical exercise and diet, will prevent diabetes. Recent large-scale study from Japan found that if you have diabetes, it doubles the probability that you will get Alzheimer's disease. So just by the simple logic, you're going to be preventing your brain from declining, preventing your heart from declining, and preventing diabetes and many other age-related illnesses. I think one thing that, one aspect that is different, of course, is the mental exercise. So with this program, you will remember to take your diabetes medicine.
Dr. Small, is there, I'm wondering about some of the characteristics that may signal a person's predisposition to Alzheimer's or dementia. And I wonder, is there any research that indicates that people who have hoarding or cluttering problems or who exhibit some degree of disorganization in their daily lives, if that is perhaps suggestive of some possibility of dementia or Alzheimer's down the road?
To my knowledge, hoarding behavior has not been a predictor of developing Alzheimer's disease. The typical predictors, the biggest one is age. Of course, genetics are important. We know about one major risk gene or allele, ApoE4, that 20% of the population carries, and that will increase the risk of Alzheimer's. If somebody has diabetes, as I mentioned, or Parkinson's, that will increase your risk. Head trauma leading to loss of consciousness will double your risk if you've been knocked out for an hour or more. So there are a number of risk factors like that, but to my knowledge, hoarding behavior is not one of them.
Okay.
I have two questions. First, what about the effect of sleep? Those who sleep long versus those who can't sleep long. Any effect on either cognition or development of dementia in the later?
Let's start with that so you don't test my short-term memory, okay? So sleep is very important, and it actually fights inflammation. Many of the Alzheimer prevention strategies are anti-inflammatory, getting a good night's sleep, eating omega-3 fats, physical exercise. So that's critically important. We all know how we feel after a good night's sleep. We're mentally more focused, we have more energy. So I think that's an important strategy, no question.
So second question is, so it is clear that early onset of a dementia, you can clinically diagnose Alzheimer, but how about people in the 80s? How sure are we in terms of etiology of dementia, whether this is due to Alzheimer or vascular? In fact, there are exercise, diet, as you alluded, with those, also other risk factors known to predispose Alzheimer's, striking overlap. So really, are we potentially dealing with a small vascular disease in the brain, if not the frank stroke?
So we are dealing with both Alzheimer's disease and vascular problems. And in fact, when we look at a series of autopsy studies of people diagnosed clinically with Alzheimer's disease, more often than not, there's also small strokes in the brain. So what happens as our brains age, a lot of things happen to them to make them not function as well. And not only the buildup of those plaques and tangles, but also the circulatory system in the brain breaks down and there's death of tissue causing these small strokes. So that is definitely true, particularly as we age.
Thank you.
Dr. Small, I'm also a Tuesday to Thursday puzzler, and I find if I go into Friday and Saturday, I have to increase my stress management program. Oh, here's my question.
I'd recommend a crossword dictionary.
Here's my question. Have there been any studies that can measure let me back up a little bit. I find that fear as a motivator never works in the long run for me very well, and I'm wondering if an approach that's more like a free will deciding from a wellness point of view
that you want to be happy, you want to have a happy life, you want to have a good life. Have there ever been any studies that have shown that a change in your attitude like that, from that positive approach, can make any difference in the onset of Alzheimer's?
I don't think that's been applied to this area, but I'm sure there's a literature in psychology about negative versus positive reinforcement to get people to do things. I'm so passionate about this, I'll use whatever I can to get people to do things to help themselves. So I think in my experience in this area, the positive approach, you know, it is not as effective. I mean, people, you know, because you think, you know, in a way our brains, the default mode is personal immediate gratification. And I think of this, you know, we're starting to study football players. And, you know, they have a higher risk of dementia because of all the head trauma, not even head trauma, but just getting knocked around and tackled. But you talk to a football player, they'll say, I don't care. I love this. This is great. I don't care what's going to happen in the future. And I think most of us are like that we don't think ahead. We don't buy insurance in the future. So it's kind of difficult to really convince young people that they should be doing this until they notice the memory changes, until they see it in others.
So we should get really scared then.
What's that?
We should get really scared then.
No, I think there's like you know, you don't want to panic people, but I think sometimes, you know, there's a bell-shaped, an inverted bell-shaped curve in terms of anxiety and panic. You just want enough so we're motivated to do something about it. I think if we're overwhelmed, and in fact, people who worry about their memory actually perform worse on memory tests. So I always tell people, don't worry about it, but get reassured, because look what you can do right now. And I think, you know, even though there's an element of the fear factor, there's also a very positive message here of empowerment.
Thank you very much, Doctor. I've had experiences with two sufferers, 99 to 2001 and 2006, 2007. 2 years rapid degeneration. The first one was a mid-70s, the second one mid-60s females. Is there any correlation between early onset, midlife onset, late onset as to how fast it progresses? Because it's really sad to see these two brilliant minds go so fast.
Sometimes the early onset form seems to be more aggressive than the late onset form, in part because it's more genetically determined. There are rare families that have genetic mutations that actually cause the disease in half of relatives in the family, and it happens in their 50s. When that's the case, you can go to a genetic counselor and find out if you're going to get Alzheimer's disease. For most people, that's not the case. It's a less aggressive disease, and it may be a combination of the buildup of the plaques and tangles and vascular disease and other things going on.
I'll go to the end for one more question.
Are you able to determine with the use of x-rays or MRIs or the like whether the plaque is there while a person is alive, or do you have to wait until after they die to check their brains?
We can see it now in living people for the first time. So at UCLA, we developed a chemical marker that sticks to both the plaques and the tangles. And we label it with a small radioactive chemical, and we inject it into the patient. It's taken up by the brain, and the PET scanner measures the radioactivity so we can see if there are high concentrations of it. And there are other similar kinds of chemical markers developed at University of Pittsburgh, University of Pennsylvania, that show the plaque. So we can see it now in living people.
Good evening, Dr. Small. Increasingly, I'm reading that mindfulness meditation has positive impact on certain diseases, for example, more recently, MS. And I'm wondering if you're finding that mindfulness meditation has an impact on the development and or on slowing down the effects or impacts of Alzheimer's disease.
So we haven't studied that directly at our institution. The closest studies we've done have looked at Tai Chi, which is sort of a mindful practice that also involves physical exertion and posturing. You've probably seen people do these slow movements. And what's interesting about Tai Chi, it seems to improve mental focus, helps with depression. We have some recent data suggesting that it may help with cognition and thinking, but it also seems to help with inflammation, which is quite interesting. And so that may be the link among all these different symptoms.
Thank you.
Thank you.
Thank you, both doctors, for doing this very important work. I've been involved in a study of memory and memory changes for many years, and it's because they're looking for Alzheimer's research information. Because I'm in that study, I get calls all the time asking if I'd like to be in another study. And the one that I always say no to is if there is a spinal tap involved. I'm just too chicken-hearted. And I wondered if what you're describing with the PET scan is something that would be instead of a spinal tap, and why doesn't everybody have that? So, thank you.
So why doesn't everybody, what was the last part? What?
Why are they using spinal, a spinal fluid instead of a PET scan?
Yeah. See, most people agree with you. They'd rather not have a needle in their spine. It just, it's a little scary. It's not that way in Northern Europe. It seems like if you stop moving, they tap your spinal fluid. So it's a kind of a cultural thing here. So the reason for the spinal taps is that you can get the fluid, the cerebral spinal fluid, that actually bathes the brain. And you can measure these plaque and tangle proteins in that fluid. And in fact, these kinds of PET scans have shown to correlate with those spinal fluid measures. So you probably don't need the spinal taps to give you a diagnosis, but it also leads to the question, do you need to get a PET scan? I mean, what if you're just worried about your memory? And I think probably most people don't, because we're not really at the point where we have a treatment that we'd recommend if you had a positive test. In fact, the Alzheimer prevention strategies are for everyone, whether you have a genetic risk or not. A recent study from Washington University in St. Louis found that people, the 20% of the population that has an ApoE4 genetic risk for Alzheimer's, that if those people exercise more, they had less of the amyloid in their brains on the PET scan. So even if you have a genetic risk, this is something that can protect your brain. Yeah.
From my two experiences, caretakers suffer more than the patients. The first one, he never forgot who his wife was. I moved in the last year. He'd shriek his name 24/7, Rena, who are you? What do you need? You need some water? It was so sad to see how stressful. Families unite and support the caretakers, because it's a very difficult job. You feel so alone.
Yeah, it really is a horrible illness that affects the whole family. And we know that caregivers get depressed. It's, in fact, being a primary caregiver of a dementia patient gives you about a 50% chance of having a clinical depression. And it's very confusing, it's very upsetting. You see the person there physically, but they're not there emotionally. And there's a mourning process that many family members go through while the person is still alive, and there's often a sense of relief when the person passes away, that you can move on with your life. So it really is a challenge.
I have one very basic question, and then I have a financial question. Can you say something more detailed about the plaques and the tangles? Where do these proteins come from? Do we manufacture them in our own brains? How do they attach to nerve cells? How do they prevent the nerve cells from communicating? And ultimately, how do they kill a patient? That's one question. The other question
Well, let's
is...
start with that, because I'll forget that. It's a big question. So So the plaques, basically they come from a protein called amyloid beta. A protein is basically a string of amino acids that are attached together. And this protein can range from 40 to 42 amino acids. And it's snipped off from a bigger protein called the amyloid precursor protein that has hundreds of amino acids in it and is attached to cell membranes. And they think the problem is that the place where it's snipped off is the wrong place. So the enzyme that snips it off is not snipping it in the right place. And instead of it remaining soluble and just getting metabolized, it kind of folds abnormally and becomes insoluble. And the thinking is that disrupts neural transmission. And if you look in those plaques where the buildup of that insoluble protein is, you can see elements of inflammation. You can see the remnants of inflammatory cells, which is another clue to what's going on. Now that's what's called an extracellular deposit. The intracellular deposit is the tau tangle. It's kind of a shriveled up neuron, and the tau is a protein that actually functions to stabilize the cell wall, and actually the part of the cell that is the long wire, what we call the axon. And it gets abnormally phosphorylated, which basically means, again, the whole system mucks up in a way that it creates these little fibers and shrivels up the cell so it can no longer function.
And then how does this ultimately kill somebody?
Well, I don't think that, we all often hear that Alzheimer's is the 4th or 5th leading cause of death. It doesn't actually get to the breathing centers of the brain. I think people die from other causes. So let's say somebody is bedridden and they're not swallowing right, they might get an aspiration pneumonia, or they can get a bed sore. So usually an infection or something else is what kills them.
Okay. And then the second question, how much does Alzheimer's disease cost the healthcare system? And how much might it cost the healthcare system as all of these baby boomers age?
It's costing us hundreds of billions of dollars, and there's all kinds of projections that are staggering. More money than I made last week, I can tell you that. And it's really, and I think the financial question is an important one, because it raises the point that's been in the news recently, that the federal government is going to put more money into Alzheimer's research and care, which we need tremendously. Right now, we're getting a little less than $500 million compared to, for obesity, it's 800 million. For cancer, which of course is important, there's 6 billion. So we really need to invest more, but we also need to be smart about our investment and how we use those dollars.
I was interested in hearing from the woman who is involved in an Alzheimer's study. I've been involved in an Alzheimer's study at BU, the HOPE study, for about 4 or 5 years or so. And I've also had my genes tested, the APOE. And most recently, I participated in a study looking at the retina. So I would encourage people to, if you have an opportunity to participate in these studies, that you do so. And is there a test for inflammation, and could this be part of a routine annual physical?
So there are markers for inflammation. We're testing it in the blood. There are brain scans that might measure inflammation, but we're not quite at the stage where this can be a routine test. So one more question, then we'll stop. Yeah.
So currently, there's no cure for Alzheimer's disease, and the disease progress over the years. And should we, as a society, consider, looking at Alzheimer's as though like a cancer or some other terminal disease? At some point, it's futile to keep patient alive with a gastric tube or other measures. And it may be better to protect the dignity of the patient at some point in the illness?
Well, I think this is an issue many families struggle with. There's the option of advance directives before, it's always a good idea to get your estate and your healthcare directives in place while you're still cognitively intact. And many Alzheimer patients do end up in hospice care. And, I think it's very painful, and it doesn't, it's a use of a lot of healthcare dollars to keep people alive when they're really not there anymore as people, and it wasn't their wish to remain alive in that kind of state.
But
Thank you.
Yeah.
Thank you very much.
Thank you, Dr. Small. And thanks to all of you who participate in Alzheimer's research. It's a gift that you give to everybody else in the world. We very much appreciate it. You have been listening to a program of Cambridge Forum recorded in February 2012, co-sponsored by the First Parish in Cambridge, the Unitarian Universalist Church, the Lowell Institute, and the Friends of Cambridge Forum. For a CD of this forum featuring author Gary Small, or for additional information about our ongoing radio series and our forum network webcasts, visit us on the web at cambridgeforum.org. In Harvard Square, I'm Margaret O'Connor. Thanks for joining us.